It's no big secret that there is a lot of corruption that's happened in drug and alcohol treatment. I worked in the nonprofit treatment industry for, I don't know if you'd call it industry, I worked in a nonprofit treatment community for 12 or 13 years, so I wasn't really that exposed to the wider trends of what was happening in drug and alcohol treatment and in mental health treatment. But as I founded my own place, I started to be exposed more to the treatment industry as a whole. I don't even like the term. And one of the things that happened is in 2009, Obama passed the Obamacare insurance. And there were a couple of small but really important facts around Obamacare. One was insurance companies were no longer allowed to exclude for preconditions. And so if you had cancer, if you had a history of fill in the blank, an insurance company said, we won't give you health insurance because of this. They could no longer do that. The other was parity laws, which meant anything that government healthcare decided to cover, private insurance on parity had to cover as well. So suddenly, every insurance policy had to cover mental health and substance abuse. Prior to that period, most insurance didn't really pay for treatment. So you're either getting treatment at the community level, or you had money, or you had some really great insurance policy. But the vast majority of people actually couldn't even get mental health and substance abuse treatment except at the community level until Obamacare. And suddenly, if you had a PPO plan for $200, $300, $400 from Blue Shield or whoever your provider was, you could go, I need to go to residential treatment. And because of the parity laws, at least in the beginning, it would cover full treatment. So suddenly, you could be a middle-class person from Ohio, and you can get drug and alcohol treatment in Malibu on the beach. Unbelievable. I mean, you wouldn't pay attention to it if you weren't working in it. And it did a few things. One thing is, a lot of people suddenly had access to treatment. But we live in a capitalistic society, and so what happens is suddenly there's a lot of potential money in the system, because suddenly you have, a couple 100 million people who have these insurance cards in their wallet that now can be exchanged for money for treatment. Wow, that's a very interesting thing. And so you have entrepreneurial-minded, generally narcissistic people that somehow, get this information. I could tell you how it happens. Maybe a very narcissistic client goes through treatment, and instead of focusing on his recovery, he's counting how much money the treatment program's making. Then he goes to his narcissistic wealthy father and says, I think we should open a treatment program at 6 months sober. Then they open a treatment program. Then shockingly, because he's shady and he does shady marketing practices, it's successful and lots of people are going there, even though the treatment is probably not very good. Then private equity and venture capitalists say, wow, there's a lot of money, in this treatment thing. And they partner with the narcissistic owners of treatment programs. And next thing you know, you have, 5,000 treatment programs open up in Los Angeles between 2009 and 2020. And kind of shocking that a lot of them aren't offering good treatment and are somewhat corrupt. And I looked at it, for me, as a very interesting story because I was supportive of Obamacare. I mean, if and when you asked me, would you like people to be able to get insurance whether they had a precondition or not, I'd say yes, I would. If you said, would you like drug and alcohol treatment to be covered, I would say, oh yeah, that's great. And you don't kind of calculate the full fallout of that kind of choice. On the patient side, you then also have patients who have no money but have an insurance card. They can live in the kind of house they never could live in without that insurance card on the beach in Malibu. But they actually have to be pretty close to being loaded to be able to qualify to live in that house in Malibu. So you could imagine that there's maybe just a handful, and by handful I mean hundreds of thousands of people who have gone in and out of treatment and continually relapse and go to these residential treatment programs and outpatient treatment programs. They have no money, they don't work, and they just have this insurance card. And I'm sure some of them are doing it maybe somewhat consciously, some of them unconsciously. Really, it's a story of bad incentives. It's bad incentives for treatment providers, that treatment's for profit and that you can make money on people suffering. That's a bad incentive. There's a bad incentive on the relapse end, that if a client relapses, insurance pays more. That's a bad incentive, both for insurance companies and not for the insurance companies, but for the treatment providers. And then it's bad incentives for clients. If I can just live in treatment, go to some groups, and I can do that for a few years, then I just relapse and I can go back and I don't have to get a job and I don't have to go through the really arduous task of growing, learning, changing, and recovering. I can take an easy way out as long as I have an insurance card. It's really problematic. It started to change. The government started to crack down, and the treatment community started to crack down. Obviously, it's not all treatment programs, but it's a really important lesson in the importance of incentives at the policy level that affect everybody in their daily lives, particularly, obviously, those people seeking recovery, suffering from addiction.